Hello everyone, welcome to Dentospedia, one of the best platform for global dental board exam. And today I am going to give you a short lecture from endodontic module, that is the pulp necrosis. And this pulp necrosis, that short lecture is very important theoretically as well as clinically. So let us see what is pulp necrosis. Actually, the pulp necrosis is nothing but the death of the pulp. It may be partial or the total, and it can occur with or without any inflammation. So it is the death of the pulp, and it is the condition when the pulp has lost its vitality. When the pulp is unable to respond to any vitality test, the pulp has become death. But it may be partial or total. It may happen due to trauma or due to any inflammation. So in the cases, if the caries has prognosed from the dentines to the pulp, and it has reached to the area when it has gone beyond the level of reparation, then it becomes pulp necrosis. But it may happen due to any other factor like the trauma. In the cases of trauma, the pulp suddenly can lose its vitality and become pulp necrosis. So we'll see the type of necrosis. There is pulp necrobiosis, that means there is inflammation plus also the necrotic area which is not able to respond to any vitality test. There might be necrosis without infection. So in the necrosis without infection, like in the cases of trauma, there is no periapical changes. So when we see a radiograph, we'll see the tooth is normal with no periapical radiolucency or anything, but there is pulp necrosis. That means the tooth is unable to respond to any vitality test. The pulp has become necrosed. Then third is a necrotic and infected pulp. That means this necrosis is maybe due to this infection. We can see periapical radiolucency. So when you can see a periapical radiolucency like this in this picture, it does means that the pulp has become necrotic due to the inflammation, and it is an infected and necrotic pulp. Now coming to the symptoms, what are the symptoms of these pulp necrosis? First is usually no pain. So it is the foremost very important point that in pulp necrosis there is no pain. That is, the vitality of the tooth has been lost. So patient doesn't complain of anything. There is no pain, nothing. We can maybe see tooth discoloration, grayish or bluish brown. We can see in the picture there is discoloration in the tooth. It may indicate pulp necrosis. Very important. Hence, the pulp has become non-vital. The pulp has lost its vitality. Hence, there is no response to any cold test or electric pulp tested. So, if we do these tests, then it will not respond. They'll give negative response. But these tests may give any response if there is partial necrosis. So if there is necrosis as well as inflammation, so here the patient may give positive response to EBT and cold test because it is partial necrosis. Coming to histopathology in necrosis, what we can see in histopath, first is the coagulation necrosis, second is liquefaction necrosis. Both are very important from exam point of view. You have to remember coagulation and liquefaction necrosis. And we can also see odor from the breakdown products. Since the pulp has become necrosized, it has become death. That's why this odor comes from these breakdown product. And we can also see tissue debris plus also the microorganisms which are infiltrate in the tooth inside and which causes this necrosis. Coming to the treatment, what is the treatment? First is the complete pulpectomy and obturation, or in the favorable condition, that is proper root canal treatment. So in the pulp necrosis, a proper root canal treatment is needed, which needs sterile instrument, a lot of sterilization without any further infection, so that there is good prognosis of these pulp necrosis after the treatment. So thank you everyone. I hope you enjoyed this short lecture. To understand the entire chapter with complete explanation, flowcharts, diagrams, and based MCQs, please download the Dentospedia app today. Thank you.